Moderna has officially asked the FDA to authorize its COVID-19 booster for all adults. More than 16% of Americans have already received a third vaccine dose. This comes as cases are on the rise across the U.S. ahead of the Thanksgiving holiday. CBS News' Naomi Ruckham has more.
Chicago is kicking off its holiday season with the return of its Lights Festival this weekend. The governor of Illinois saying it's time to return to pre-pandemic tradition.
After we all spent last year's holiday season apart so that we could keep each other safe from the pandemic, this year I'm cherishing every opportunity for togetherness.
But during the past 2 weeks, new cases of COVID-19 have doubled in the state as breakthrough infections surge across the country. Minnesota is one of the hot spots. The governor says federal emergency response teams are on the way to help overrun hospitals. The newest wave coming even as the CDC says nearly 200 million Americans are fully vaccinated, and about 10% of children 5 to 11 have received a first dose. Now the focus on boosters is intensifying, with the FDA expected to authorize Pfizer's extra shot for all adults as soon as Thursday.
CDC will quickly review the safety and effectiveness data and make recommendations as soon as we hear from FDA.
The CDC currently recommends boosters for people 65 and older or at high risk. But a growing list of cities and states aren't waiting around for the federal government to revise that policy.
So how do you get rid of this pandemic? It is so simple. Get more people vaccinated.
Tracking the rising infections, the NFL is cracking down. The league saying starting Thanksgiving, all players and staff will wear masks indoors, regardless of whether they've been vaccinated. Naomi Ruckham, CBS News, New York.
For more, I want to bring in Dr. Owais Durrani. He is an emergency medicine physician in Houston. Dr. Durrani, as we just heard, Moderna and Pfizer are both asking the FDA to authorize their booster shots for all adults. Several states and New York City have already gone ahead and expanded eligibility without the federal green light. Remind us, what does the science say in terms of how important booster shots are?
Yeah, thanks for having me this evening. I think right now we have trends that show undeniable decrease in vaccine effectiveness as time goes on. And we have data from here within the United States, the United Kingdom, and many other countries that prove this. And so I think we're at the point where we can say that these mRNA vaccines are 3-shot vaccines. And once you're 6 months out from that second shot, you need that third shot. Unfortunately, there's been some confusion in terms of our kind of governing health authorities in terms of getting that information out and who is eligible and who's not. But it seems like they're about to rectify that here in the upcoming days. And so when my patients come to me, I say, if you're 18 and over and it's been over 6 months since your second shot, go ahead and start planning to get that booster. And it's going to lead to a much more safer holiday season for all of us.
And that's what we're all hoping for, of course. I want to talk about kids. It's been 2 weeks since Pfizer's low-dose vaccine was authorized for children between the ages of 5 and 11. The White House estimates that more than 2.5 million kids have already received their first dose. What's your reaction to these numbers? And remind parents, like myself, whose children have had one dose, how protected are their kids at this point?
Yeah, those are exciting numbers. I think they're better than a lot of us were expecting. And it means that we're once again going to be heading into this holiday season in a much different position than we were in last year. It's going to lead to us sending our kids to schools and not being worried about lapses in their education and quarantine issues and whatnot. And as I mentioned, we're going to have some level of protection for those kids heading into Thanksgiving. But a lot of the kids are going to have full protection heading into Christmas. And so I think heading into Thanksgiving, the keys are going to be, your kid's going to be partially protected, not fully protected, using those rapid antigen tests, using masks when appropriate, and making sure that we're still taking some precautions, but we're going to be going into that season with a higher level of protection than we had, even a couple weeks ago.
So keep doing all the same things until they're fully protected, and then we'll see where we all are. And in terms of the progress that we're making, it seems like every time we make a step forward, there's also a step back. And at this point, the CDC says that they are no longer predicting a decrease in coronavirus deaths. Instead, the CDC expects that deaths will remain stable or have an uncertain trend this month. What are you seeing at your hospital there in Texas?
Yeah, so here in Texas, we had the worst of our Delta surge kind of during the late summer months. Thankfully, now we've kind of come down from that, and we do have better hospital capacity. Anecdotally speaking, I work full time in Houston, but I do pick up some shifts in East Texas. And so in Houston, for example, we have a better vaccination rate compared to East Texas. I see a handful of COVID patients during a shift, and I admit maybe a handful of patients every week or so. Compare that to East Texas, where most of my patients, when I still ask them if they're vaccinated, they are not. And there I am admitting 1 or 2 patients a shift. And so that's just a difference between 50 or 60 miles. And we're seeing that play on a national stage right now. You look at, the Great Lakes region, lower vaccination rates, they're starting to see their hospitals fill up. You look at Vermont, the cases are going up, but because of the vaccination rate, their hospitals are not filling up. And so it's essentially that experiment being played over and over again, and just takes us back to square one, which is get vaccinated, get your kids vaccinated. It's the number one tool we have to, prevent us from going exponentially the wrong way.
Finally, I want to, it's interesting, really. It feels like it has been forever, and it feels like in some ways it couldn't possibly have been 2 years. But Wednesday marks 2 years since China recorded its first known case of the coronavirus. Since then, over 254 million people have been infected globally. More than 5 million people have died. What are some of the most important lessons that we've all learned, and what are your thoughts for the road ahead?
Yeah, it definitely feels like a lot longer than 2 years for sure. I'd say lessons can be put into what we can use going into holiday season and kind of bigger picture things. Heading into the holiday season, as I mentioned, get yourself vaccinated, get your kids vaccinated. Rapid antigen tests are going to be your best friend before any type of get together, before any type of travel. And masks are never the wrong answer. Those few tools will keep us all safe going into the holiday season. Kind of bigger picture, we already knew we had socioeconomic disparities in our healthcare system, and those were magnified by what's happened over the last 2 years. They've led to a lot of death in minority communities, in communities that are not as well off, and unfortunately, that's still going on right now. And so that's something that we just can't ignore anymore. On top of that, we've obviously learned that science is not immune to politics or disinformation, and we need to, as a society, have a conversation about how do we proceed from here? How does science become a thing where we all focus on the facts and not he said, she said, or Twitter comments? And so I think those are kind of the big picture things that I've taken away from the last 2 years.
Dr. Owais Durrani, thank you for being here, and thank you for all that you do.
Thank you.